So today we are going to talk about one important topic, that is IS IHD. Okay, what is the full form of IHD? Ischemic heart disease. Okay, so this is very important topic. Okay, so let's discuss about ischemic heart disease. The another name of ischemic heart disease is angina pectoris. Also, some doctors will call this angina pain. Okay, pectoris means pectoral region. So pain in pectoral region will indicate angina pectoris. Okay, this is cardiac pain. Very important to understand why this pain occurs. Okay, the heart having its own circulation. Okay, the heart having its own circulation. Okay, so when any circulatory issues occur to the heart, we know that there is a layers of pericardium, endocardium, myocardium. Okay, these are the layers of the heart, endo, myo, pericardium. Okay, so the myocardium will start damaging. What will happen? It start damaging due to the lack of supply of oxygen, lack of supply of glucose, lack of supply of vitamins, and required amount of sodium, potassium, everything needed. So minerals. So all things are decreased. Okay. So due to this myocardial, we'll also call myocardial infarct, pericardium, myocardium infarct also, or ischemic heart disease. After that, what will happen? Myocardial infarction. So what are the reasons behind that? There is a decreased flow of blood into the heart. Okay. First thing, and second thing is that there is uh, any arterial issues or any embolism between the arteries. Okay, that is the reason. Or lack of blood cells also lead to angina, because the red blood cells bringing HB decrease, red blood cells decrease. So what will happen? The amount of oxygen is supplying to the heart is decreased. Okay, and another thing is that due to the sometimes due to the anxiety, depression, overload of blood to the heart during exercise. This is also reason behind the cardiac arrest. So you can see nowadays there are a number of persons while doing gym exercise, suddenly they are getting heart attack. Why this happening? Because with that anxiety, with the depression, they are doing the exercise mostly, or taking uh, we don't know, but as maybe or not taking steroid injections, okay, which increasing their stressful conditions, anxiety, their fight, or they are want to fight, means they want to go in aggression and want to do the gym. Exercise is one thing you need, did not want to take stress. You need peaceful, calm mind, not overthinking, only focus on exercise or gym, okay, without any aggression. Okay, then your body will respond to that exercise. Okay, it will give proper nourishment to the exercise, which will give proper development to the body. Okay, so during stress, anxiety, uh, the body doesn't do proper function. Okay, it will release the hormones. Okay, parasympathetic hormones are released like epinephrine, non-epinephrine, etc. Okay, so this is very important thing we have to remember. Next, uh, there are the reasons, and we talk about the things related angina. What is the clinical symptoms? This is very important. Okay, clinical symptoms. There is one symptoms, that is pain. Pain in chest is the one important uh, clinical feature that will give you the perfect diagnosis. So what will happen? The pain will start or arise from the chest, from the chest, and radiates towards the left arm or left upper limb. Okay, this is the one of important symptoms, and it will come to the little finger. Okay, so it start from forearm, wrist, and upper arm, and it will come to the chest region. Okay, so this is the very important thing. So the cardiac to the little finger pain, along with sweating and sometimes SOB, these are the primary and very important symptoms, clinical features. Okay, it is very important. Okay, sometimes the pain is burning pain. Okay, burning pain. Okay, burning pain. It is about 2 to 3 minutes, and he will have rest for 5 to 10 minutes. Again, the pain will continue, the burning pain. So it will go one on and off. The pain will come and go. Okay, by laying the sometimes the pain increases also. You need to take this type support, then the pain will vanish for some time, and again the pain will arise. So it will gap to 5 to 10 minutes, and the pain have 2 to 3 minutes. This will happen. Okay, so here we are grading the pain. We have the grade one angina pectoris, means while walking you have pain, while fast or some not was brisk walking you have pain, when you are going to upstairs this time you have pain. So that is grade 1. And you have grade 2, only by walking, not fast walking, only small walking, minimal walking give rise to pain in chest region. This will give to third grade. Okay, when the patient is walking very slowly with support, then also they have pain. So means he is grade 3. Now do have grade 4. During resting position also the pain will arise. Any position you will have this grade 4. So fast walking pain grade 1, while walking normal walking grade 2, very slow walking grade 3. In resting position also the patient has telling about the pain, means grade 4. So when the attack start, the patient is silent sometimes. Okay, he doesn't have motion. His face become pale. Okay, but sometimes the pulse is normal, or sometimes the fluctuation or pulse can see in your when you check the pulse. Okay, and the pain in the chest region like this tenderness, someone is pricking him. So throbbing pain he will get while the attack. Okay, so this is very important, taking uh, proper examination. Okay, proper taking history, proper diagnosis is very important for this type of diseases. Okay, because it is the matter of life and death. So what you will see, you have to do ECG. Okay, and in emergency condition need 2D echo with drop eye. Drop eye will give the exact value whether the muscles of the heart are damaging or not. Okay, in ECG we'll able to see the ST elements elevated, that ST segment elevated. Okay, elevation. This will give the idea of whether the heart is working proper or not. Okay, 2D echo. This will give the overall picture of the heart. Right after that, you need to consult the doctor and take advice according to that and took the treatment. Most of the nowadays the coronary artery blockage will having doing shunt, if not surgery, bypass surgery. Okay, likewise the surgeries are happening. Okay, with the benefit. Okay, but the expenses are very high. So normal people sometimes they can afford, they will afford or not. Okay, and after that life becomes very means dependable. Okay, you need to take help of the persons while walking. Okay, unable to walk fast. Okay, you need do not panic. Yeah, you have to drop your anxiety, fear, depression, etc., etc. Okay, so this treatment need first cause and then the treatment will start. But initially you can give, you have the S5 A3 BE. Okay, next you have C5 N1G or A1 rapid also you can give in D6. These are the primary treatment, and according to the B, you can apply B also on the chest region. After doing the test and other things, you can easily manage the patient. You have to apply BE. Okay, S5 A3 B, C5 N1G, D6. A1 D6 you have to give on the direct on the tongue. A1 alternate A3. Okay, these are the remedies will help the patient. Okay, and if there is no chronic issue, there is no severity, the definitely the patient will come back to normal condition. But if the serious condition is there, need further management. Okay, so this is all about the heart myocardia, sorry, ischemic heart disease or angina pectoris. Any doubts, kindly ask.